So it gives me great pleasure to introduce Glenn Rees to present to our members today. Glenn has worked at senior levels in the British and Australian public services. In Britain, he worked as a private secretary for senior ministers in the Cabinet Office and in economic departments. In Australia, since 1976, he worked in program and policy areas, including Prime Minister and Cabinet, employment and training, aged care, disabilities, housing, and the Aboriginal and Torres Strait Islander Commission. He was chair of the Nursing Homes and Hostels Review in 1986 and was involved in implementing the first wave of aged care reforms. He was CEO of Alzheimer's Australia from the year 2000 to 2014, and I feel very privileged that I had some time working with him there as a consumer and employed for a little while. During his time as CEO, the Dementia Initiative was implemented in 2005 with $320 million over 5 years. Important funding commitments made to tackle dementia in the 2012 aged care reforms in Australia, including timely diagnosis, acute care, and dementia risk reduction, and $200 million committed to dementia research in 2014. Dementia in Australia is now a health priority as well. Glenn's been a member of many government advisory committees and an active member of the National Aged Care Alliance. He became chair of Alzheimer's Disease International in April 2015 and is an independent board member of Parkinson's Australia. It gives me great pleasure to introduce Glenn today, and he's going to discuss with us the global perspectives of dementia. What are the priorities? I'll just bring up the PowerPoint, Glenn.
Okay, Kate. Just while you're thinking, do I stick to the same sort of time scale, or should I be a bit shorter? How long have people been on the line?
I think you were planning to speak for 30 minutes or something?
Yeah, 20 to 30 minutes, yeah.
That's fine. I'll just share your PowerPoint now. Okay, so over to you, Glenn.
Well, thank you very much, Kate, and sorry again to everybody for being so disorganized. This is, of course, World Alzheimer's Month. There's a lot going on, and one of the questions that I would be interested in is your views, the views of members of DAI, in the theme that we have for the month, which is Remember Me, and the logo that you can see on the slide at the moment. So that's just a little question to set you all off. One of the things that gave me most pleasure last year was working as chair-elect on the ADI board to establish, with Kate's help and others, DAI as a partner of ADI. I've been around a long time, as you can see from my face. I'm about 73 years old now.
I think it's a happy birthday day today, Glenn, is it?
No, that's tomorrow. That's another confusion.
Okay.
So I've been around long enough to know that, however well-intentioned, if organisations set up groups, they tend to lead to some element of control and frustration and tension. And in my opinion, it's much better to let consumer groups, if you can, be their own masters, but to establish a basis for respectful partnership. I think that's what we've established with DAI. We have a program of work now that ADI hopes to support with DAI. We have plans for the future to ensure that DAI have a public face at conferences in terms of their own time to organise speeches and presentations in the way they want for conference participants. So I wanted to say at the outset that I detect nothing except very strong support from the board and from member organisations for the DAI partnership, because it is so very hard to get genuine consumer input. So having said that, I'd like to move on now to what I'd like to say today, which is really around three themes. So the first thing I want to talk about just quickly is the global impact of dementia. I want to talk about the opportunities that I see for advocacy over the next 12 months. I want to float with you a few priorities and to see whether those are shared with you or whether you have other thoughts. And lastly, just to say a bit about what the drivers for change are at the international level. I'm sorry.
Let me know if you need to change slides, Glenn.
Number 4, Rons. So I'm not going to test you all on the 80 pages of the World Alzheimer's Report 2015, but I do hope you've had a chance to look at it. I think it gets a bit wearying for people with dementia to hear endlessly about figures, but I would say that the figures are critical to advocacy at the political level. So we know from the report that there's been a 12 to 13% increase in the global estimates of people with dementia. And we know that that's largely a combination of better statistics on the world population of older people. And we know it's because there's now better evidence of the numbers of people with dementia in low and middle income countries. So we know that there's about 46 million people with dementia worldwide. We know the number's going to grow to 131 million by the middle of the century. We know there'll be nearly 10 million new cases of dementia in 2015. And we know the cost in 3 years' time of dementia, both in terms of health and in terms of family carers and informal support, will be about $1 trillion. That's a number with 12 zeros. I'm not sure how you think, but a number with 12 zeros is a bit beyond my daily comprehension. So there's a lot of analysis in the report. It says that the disability burden of dementia in terms of quality of life is grossly underestimated, which is very unhelpful to health policy. It also says that the best assumption we can make about dementia is that universally the prevalence rates are the same everywhere. So while there's an interesting debate in high-income countries, particularly the UK and Sweden and Denmark, about whether the numbers are now much lower than would have been projected 10 or 20 years ago, the conclusion of the report's authors is that the best approach is to keep the same assumptions about prevalence rates across the world. So look, that's all I want to say about the report. The political reaction, at least in Australia, was good in terms of looking at the figures, and particularly the $1 trillion figure caught the imagination. So I suppose the question is, can ADI, can people with dementia be content with, or more optimistic is perhaps the better way of putting it, about whether the message is getting across at the global level? I think the answer is yes, but of course that's hard to prove in terms of the main outcome, which is whether the quality of life for people with dementia is getting any better. And the answer to that, outside of some higher income countries, is probably no. So we know the message is getting across. We know, slide number 9 now, Kate, we know that the global evidence base that Martin Prince and the World Alzheimer's reports have established has got a lot of the information across to policymakers in places like the World Health Organization. We know, secondly, that the language around dementia has changed dramatically. in many countries over the last 10 or 15 years. And if you want a revolution in thinking and culture, then changing language is probably the most important place to start. So having dementia regarded as a public health issue, talking about it more as a social as well as a medical issue, talking about dementia-friendly societies, I think that way of talking is light years ahead of where we were in the 1980s, for example, when I first became engaged with aged care policy and dementia. I would also say that we can be optimistic in terms of the number of ways in which we can pursue our advocacy. We have the WHO, this is slide number 10, I think, Kate, that's right. We have a multiplicity of channels. We have the World Health Organization, we have things like the Glasgow Declaration, we have 20 dementia plans around the world in various countries. We hope that will be 25 by the end of the year. We have the Organization for Economic Cooperation working on quality of dementia care. And most recently, we have the prospect of some activity around whether dementia is included and can be actively included within the Convention on the Rights of People with Disabilities. I know that issue is important to some of you, and the board have decided, the ADI board have decided to partner with Alzheimer's Scotland in trying to produce some recommendations and publications around what that particular convention, or indeed human rights generally, should mean for people with dementia. Human rights, I think, is sometimes regarded as a somewhat legalistic and complex kind of issue. And I think the first step for us as an organization is probably to demystify it and to articulate more clearly what the things are that matter in terms of human rights to people with dementia. For example, equality before the law in terms of how to make decisions around capacity, how to have support and care delivered in a way that results in independent living in the community, to ensure through human rights that access to services including education, sporting activities, and the things that we do day to day as members of the society are available to people with dementia. So that's a piece of work that we're looking forward to doing. We hope that human rights will be on the agenda at the ADI conference in Budapest next year. And I'm looking forward to hearing from Alzheimer's Scotland and whether they'll be able to agree to working with ADI. I think the other thing that I will say in terms of some optimism is that dementia, I think, is becoming regarded as much as a social as a medical issue. In some countries, the focus of dementia has been driven very much by doctors, and we should be grateful for that. But we really do need to keep the social elements, the human rights elements of dementia in front of people's minds. And I think that is happening. I think it was significant that the World Global Dementia Initiative that David Cameron initiated started off with a cure by 2050. So I think it was 2025 actually, I think that slide's wrong. It was 2025. And now that's a good objective, but it was interesting that at the end of the 2 years of the global initiative, that the focus was not only on research it was on care and other things that go beyond simply research and medical science. So let me move on now from, if you like, grounds for optimism on global advocacy to how do we actually focus our global awareness, our global agenda. Those of you who have looked at the World Alzheimer's Report 215 might have got to the last page. And the last page actually has what I think is probably the most important part, which is what does ADI think are the main priorities, both in terms of the channels for advocacy, the opportunities for advocacy, and also what the objectives and priorities should be of calls for action at the global and the country level. So it's quite a long list, but the list needs to be long. And what it includes is awareness raising of dementia, creation of dementia-friendly communities with the objective of reducing stigma and social isolation. There's the promotion of risk reduction measures. There's the measures to improve diagnosis and reduce the average length of diagnosis. Support for family carers, including through information, social support, respite and counselling. And I had the opportunity recently of being in Scotland and very much liking the idea of a post-diagnostic guarantee that gives people with a diagnosis the assurance that they will in fact receive support and care and advice on how they should handle dementia over the coming years. There's access to long-term community and residential dementia care services and to enhance care for people with dementia in hospitals. There's workforce strategies, and most countries, I think, who are higher income would regard workforce as their nightmare. They simply do not know where the family carers of the future and the workforce of the future is going to come from. There's a debate to be had about the use of technology, both in personal care and in extending care services via information technology to rural areas, for example, in respect of assessment. And then lastly, there's an issue that has hardly been tackled by Alzheimer's Disease International, or indeed by many higher income countries, and that is to think of models of care and support that provide people with dementia the good quality end-of-life care that respects their dignity and personal wishes. And certainly in Australia, we know that end-of-life care has had very much a cancer focus, and there's very limited discussion really of end-of-life issues for people with dementia. And it's true in Australia, and I think it's true worldwide, that people express the wish to die at home or even in residential care, but end up in the traumatic situation of facing end of life in a hospital, which is where they don't want to be. So let me make 3 observations about how we should approach our advocacy from ADI. First, we're going to continue to press countries to have dementia plans. You can't tackle an issue as enormous as dementia in social and economic terms unless you have a plan. Second, and this is really important, I think, we need to insist on systemic change, change that touches all parts of the health and social care support system. It's very nice to have little bits of money for demonstration projects and this and that, but the world of dementia is not going to improve unless system change happens in terms of key issues like diagnosis, hospital care, and access to community and residential care services. I think it's also important to insist that the mistakes of high-income countries are not replicated in low and middle-income countries. I can only speak for Australia in this context, and it's evident in everything we've done over the last 25 years that we've had a lot of work to do in correcting the excessive priority that was given to institutional care prior to 1990 in Australia. And we're still recovering from that era in trying to get community care to be a more significant part of the Australian approach to aged care and dementia. So, what are the drivers of change? I'll just note these quickly because I think they flow from what I've said about the opportunities for advocacy earlier. They revolve around good political leadership. David Cameron has shown that. You need a political champion to really argue the corner for dementia. That's certainly been the case in Australia. We've had good political leadership from both sides of our political spectrum, and you need that bipartisan support if you're going to succeed. And you need politicians to be able to talk about dementia without reading the script. You need them to have a heart and a feeling for dementia. And in Australia, it's the case that you can go to parliamentarians and talk about dementia and they will know exactly what you're talking about. Civil society is critical. We've seen in the Global Dementia Initiative that I mentioned briefly earlier that David Cameron initiated, that it's been civil society, Alzheimer's organizations, ADI, that have made sure that the agenda for that initiative is more balanced between research and access to care and support and the involvement of people with dementia. We ought to be advocating for the G20 to pick up the issue of aging and dementia as a key economic and social issue. Those countries represent about 80% of the world's population of people with dementia. It includes countries like China and India and Indonesia and I think Mexico and Turkey, all countries that are emerging economies that we need to understand and be involved in the debate on dementia. The World Health Organization is clearly critical. The Ministers' Council meeting on dementia earlier this year was really quite successful. I've seen various figures of the countries involved, but the number I remember is 89. And many of the countries that spoke quite forcefully about dementia were from lower middle income countries, and that simply couldn't have happened a few years ago even. Most critically, the drivers of change are going to be Alzheimer's organizations, whether country-based or ADI. They have to be the drivers. They've been in the business now, in many cases, for 30 years or more. They're now, in many cases, inclusive of people with dementia, and they are going to be critical. And then I think the last thing I've mentioned on this particular PowerPoint is the Global Alzheimer's and Dementia Action Alliance, which establishes the important principle of Alzheimer's Disease International working together with the World Council of Churches and other major organizations like HelpAge to prosecute advocacy around dementia. Let me say that ADI isn't a particularly well-resourced organization. We have probably at a maximum about 10, 11 full-time staff. that would be a very small number compared with many of our members. And while I think Mark and his colleagues have done a tremendous job over the last couple of years in their global advocacy, it's clearly the case that we could do a lot more if we were better resourced than we are now. I think ADI could be more effective if it works more closely in partnership with our member country organisations. I told you about the partnership we're hoping for with Alzheimer's Scotland on consumer advocacy and human rights. It's clear that we have a lot to learn across the world from the way in which Japan and the UK have implemented dementia-friendly communities and dementia friends. So let me conclude on a note which, as an advocate, I believe, and that is that if at times you get depressed, you simply remember that advocacy, like water dripping on a stone, will eventually get through. And if your case is strong, as it is with dementia, you'll get the outcomes that you want. If not always for the present generation of people with dementia, for future generations of people with dementia. So thank you for the opportunity of speaking. I hope I haven't spoken too quickly. I hope my very pommy come Australian accent is understandable to you all. And I'm very grateful for the opportunity to talk. And Kate will circulate the notes that I've used for this, although I've spoken to them a bit loosely. We'll circulate the notes that I've done for this so that those of you that want to reflect on priorities and World Alzheimer's Month and give me comments via Kate or direct are perfectly willing, perfectly free to do so. So thank you very much.
Thank you, Glenn. Are you happy if I publish the notes with this recording on our blog this week, Glenn?
Yes, I've noticed a couple of small errors, like I got the year of the World Alzheimer's Report wrong in a couple of places, which shows how confused I am.
I'll correct that for you.
Well, I'll send them through to you and you can use them.
Okay, fantastic. So does anyone have any questions for Glenn?
Well, just one real quick correction. It's the G7, not G8.
Yeah, we lost Russia on the way through.
Glenn, I have a question about the UN Convention on Disabilities, and as you well know, in Australia there's no reason why people with dementia wouldn't be covered under the DDA. What are some of the problems internationally? Just can you outline a few?
Problems in terms of getting recognition, or problems in knowing whether it's relevant to people with dementia? I think, I mean, if I can speak for Australia, and let me be honest in not claiming to have a depth of knowledge about the convention, at least in Australia, dementia and aged care have been very pragmatic. And while, of course, we advocate for change, you'd have to say that in the Australian environment, aged care and dementia has been much better funded than disabilities.
Yes.
That's until recently. Over the years, I've frequently said that the contrast between aged care and disabilities in Australia was interesting. And it was the case that older people should think more in terms of what their rights are and what they're entitled to, and not simply being content with what the system was prepared to give them. That hasn't been the case. And I think that's partly the generation of older people who've been more quiescent in accepting what's been there. I'd also say, and I think this is a difficult debate for me to have because I don't want to seem negative, I also think that conventions and legal rights sound complex and a bit philosophical and a bit abstract. And what the average person wants in their everyday life is practical assistance that makes a difference. Now, I may be wrong about that, and I may need to be corrected, but the reason I'm really positive about ADI working with Alzheimer Scotland is because they've managed to make human rights understandable and translatable into practical action. So I think personally, and as I say, I'm a newcomer to this, I think the trick is to look at the sort of issues I mentioned around education, voluntary employment opportunities, diagnosis, post-diagnostic guarantees, safe care in hospitals, whatever it is, as a right that should be accessible to all in simple terms that gets that message across. And I think even in the disabilities sector in Australia, outside of the disabilities sector, the average person would have no comprehension about what the convention really represents in terms of opportunities for a real life. And if we could talk about the convention as an opportunity for a real life in terms of what everybody expects day to day, in respect in shops, respect from the hairdresser, respect from the banks, understanding before a court of law, whatever it is, we'd get the message across. And quite frankly, I think that is all a mystery. And if we can unlock that in some simple debate, some simple publications, and there is a publication that the Mental Health Council in the UK, I think, have now published, that helped me for the first time actually understand these issues, then I think, Linda, we'll start to get across a message that's very important. I hope that helps.
Thanks, Glenn. I muted you, Linda, if you wanted to respond.
Sorry, Linda, you're not coming across.
There we go. Is that better?
Yes,
Yeah.
it's fine.
I totally agree with you in terms of people's real lives, but what I have found in 30 years of working with the DDA in Australia and across a wide range of different people, because I work for technical education in New South Wales in access and equity, what I found is incredibly important in my personal life in supporting people, Vida now with a diagnosis of dementia, someone else with another diagnosis in my past, has been the issue for people themselves to realise that they do have some basic rights, for them to see that in themselves. And I think that's the most important point about the DDA. And I think as a lesbian woman, I certainly learnt in the 80s that through the AIDS crisis, that the issues of capacity, the issues of social cohesiveness, of mutual responsibility for one another are incredibly important. And in order to get that groundswell of movement and support happening where public services don't provide enough, people have to actually believe that they're entitled to it. And so I find it difficult in my local community to counter the perception of other carers, for example, I hate the word, but care partners, let's say, who say, oh no, but dementia is not a disability, it's a terminal illness. And how do you turn around people's mindsets so that people start from a position of empowerment? That's what I'd like to find out.
Thank you, Linda, and hopefully we can involve you in the work we do over the next 6 months, because I think that's what I like most about the Scottish approach. I mean, I know it's still developing, but if people are reluctant to get a diagnosis of dementia, it's not just because of the stigma, it's because they don't know whether there's anything there to help them. And if a doctor simply says, go away and live your life, That doesn't help.
Excuse me, yes.
I have a question also, Glenn. One of our listeners here today, Kirsten, she heard Dr. Norman Swan on radio being interviewed recently and reminded me I heard him last week. And he said that in some jurisdictions, dementia diagnoses or rates are plateauing or even lowering. Can you comment on that, please?
Yes, can I start now?
Yes,
Yeah,
please.
I touched on that a little bit in what I said to you. There is an analysis in the World Alzheimer's Report 215 of the evidence for and against the possibility of changes in the incidence or the number of new cases of people with dementia. And obviously, the numbers of people with dementia are made up of two things: the number of new cases and the aging of the population. So they concluded that they saw no reason at this stage to change the basic assumption that have been in the rates for many years, that across countries the rates are going to remain much the same for the future, and they were not inclined to adjust future projections. That was their conclusion, and I must respect that since they are the experts. Having said that, I personally think that common sense suggests that if dementia is a chronic disease, which we say it is, it will, like heart disease or cancer or diabetes, be susceptible to other influences other than aging. So education, public health, smoking, the effective management of other diseases may push the rates of dementia down and the number of new cases down. On the other hand, if rates can go down, they can also go up. So if you look at lower middle income countries, and if you look at increasing rates of smoking, if you look at the increasing rates of heart disease in some lower middle income countries, probably as a result of smoking, then you might conclude that in fact the numbers of people with dementia will go up. So I think the important point to draw from what Norman Swan said isn't a confidence that rates will go up or down. It's the certainty that they will change over time. And we don't know whether globally that change will be up or down for particular countries. If you look at the UK, and I think this is true of Sweden and Denmark, there are some researchers who are very, very well qualified, like Carol Brain, who've done research which suggests that the numbers have come down really very, very significantly. Maybe 10 to 20% is what I remember. But don't hold me to that. But I simply want to give you both sides of the equation. So there's one group of researchers that say, hold on, the evidence base isn't good enough. And another bunch who say, well, in some higher income countries, the evidence really is quite good.
Thanks, Glenn.
By the way, I thought Norman was a bit optimistic.
Yeah, I did too, actually. Any other questions? Anyone that's here? I think that probably wraps it up, Glenn.
Hi.
Sorry, Mick, you've got a question?
Yeah, Glenn, thank you for your presentation. It was very enlightening. I totally agree with you about advocacy work. It has to happen, and it has to keep increasing. It's the only way that we are going to get it out there for us. And I find once you get into it, it's very easy to change people's perception of it. But my question to you is, how do you see Dementia Alliance International working alongside or with ADI in the future?
Well, we're in the early days, but I think the early days are very positive, and we owe a lot to Kate and others for that. I think I see it working like this. I see, firstly, that when we say partnership, it means that we can disagree as well as agree. So it may be on some issues that you think we're not going fast enough, or we've got it wrong in some way, and we consider your views, but we still think we're right. Or equally, that you have a view that pushes us much faster than we think we possibly can, for whatever reason. And I hope that you will equally accept that we do that in good faith. So I think the cornerstone of the relationship is the agreement to agree and disagree, as well as to agree furiously on a lot of things. I think secondly, we offered, going back 6 or 7 months, to try and help DAI do a bit of fundraising. That's obviously easier when you know what projects that you want to prosecute. But we now have an agenda from you that includes writing a document around consumer empowerment strategies, around timely diagnosis, and around communication. And while we don't have a lot of money, we hope that with pro bono support from good authors and yourselves and our resources, we can produce some documents that are good. And I know that Kate's working as well on a document on dementia-friendly communities that will see the light of day at the ADI conference next year, I hope. So look, I think there are projects that you will do, and there may be projects that we do together. Kate and Peter Mittler, since the middle of this year, have urged on me the importance of the human rights agenda. I started on it pretty much from a standing start, because I've always been very pragmatic in my life in pursuing things. But with Kate and Peter's help, I've read things and been persuaded that this is really something we should get into, for exactly the reason that Linda said, which is that if you don't feel you're entitled to something, you don't bloody well try very hard. You know, you got to push. You got to push. You got to know what your rights are. So look, I think there's grounds for optimism. A lot of these things revolve about personality. I think the real test of this will be that when Kate and I have moved on to whichever fields we move on to, that the relationship between ADI and DAI will be strong. So it shouldn't be based on personalities. I think it's been helped a lot by the fact that Kate and I get on well. Kate works well with other people like Mark. So the thing has moved on. So that's the way I see it. I do think that DAI needs a public face in terms of publications and intellectual capital. As a policy person, it may sound old-fashioned. I actually think that publications, whether they're electronic or whether they're hard copy, are hugely important, because people can actually read, think, and reflect. It's why the World Alzheimer's reports are important. It's why we've achieved what we have in Australia. There's 50-odd publications that Alzheimer's Australia have put out over the last 15 years, 3 a year or more. And that gives you a public face. I think the only other thing I would say, and I know you're working very hard on this, and the language barriers are a problem. We really need to be a very broad organization, DAI, in terms of membership from countries across the world. That's not easy in terms of language and geography, but hopefully as different countries have consumer organizations of people with dementia, you can link up with those and get a broader base of support across countries. That would be a really wonderful thing. So I'm optimistic. I think there's good grounds for hoping that our partnership works. And I think that basis of mutual respect is the thing we have to hold on to.
True.
Thank you, Glenn. That's fantastic. No, I think I just want to make a comment, Linda, for you. When a lot of people say to me, but dementia is a terminal illness, I say to them, my way of dealing with it is I see the symptoms of dementia as disabilities, but still deal with the fact that it's a terminal illness. So it kind of brings it in a different way. So do we have any more questions for Glenn, particularly as you've managed to find your way through to see us this morning, Glenn, considering such difficult personal situation? I'd really like to thank you for that.
Faith's got her hand up, I think.
Has she?
Faith.
Yeah, Faith, is that?
She's turned off. Mike's turned off.
Faith. Sorry, start again, Faith.
Okay.
Yeah.
Thank you for all your work that you've done and for giving this talk. And I just had a few things to add. I'm in the United States, and you mentioned about the disabilities, and yes, we probably do need to really come up with something very clear. But I just want to mention that many years ago here, the Americans with Disabilities Act came out, and there was just a sort of visual comment about people in wheelchairs and movie theaters and how they were forced to be in the back. And that really brought it home to all the Americans and opened them up to have seating in the center in movie theaters. So, you know, I wanted to add, just for your radar, ideas for things about care for people under age 55, because most memory care clinics and everything like that are for older people.
Yeah.
So some of us young onset do not have any services. And I know that as far as technology, there's a lot of apps for caregivers, but very few apps for helping us with daily life.
Mm.
And then also my question to you, because you have on your thing about providing support for caregivers, and I know the Alzheimer's Association has a huge support for caregivers. But what's really lacking in this world, and I think maybe even why this organization began, is because there really isn't a lot of support for the actual people with dementia.
Mm.
So just some thoughts for putting on the radar, but do you see that there is countries where there's no support for the caregivers, that still needs to be on the agenda?
I think so. I mean, if I had the privilege recently, well, not recently, last year, of going to Nepal, and that they invited me because they wanted somebody independent and slightly stronger than they felt to talk to their ministers and say exactly what the things were that they needed, and they just wanted help in their advocacy. But I had the opportunity of meeting a lot of people in Nepal, and there was no understanding anywhere in the health system, among families, of dementia. And the very few services there were around doctors who were trying their best to interest people in the issue weren't used because of stigma and social isolation. So I actually think around the world, Faith, we have to get ownership of the issue of dementia by families. I don't particularly like the word care either. I mean, I've supported my daughter with mental health for 25 years. I don't regard myself as a carer, I'm a father. And I would love more support. So I do think the carer thing is important. And when I think about services like respite care, which I think are really important, I think of them in terms of benefiting both the person with dementia and the family carer. Now, in some cases, people will want to be together on a respite program. They want to go on holiday together. In other cases, they'd like a break from each other. It doesn't matter. But I think that if people are going to be in the community and not socially isolated and to be understood by others, we need to have the carer agenda on our minds as well. And we need a well-educated community. So what it would be true in Australia to say that the mindset of Alzheimer's Australia was completely carer-oriented until 2000. Absolutely. I think we're a much more inclusive organisation now of people with dementia, and not as good as we might be perhaps, but a lot better than we would have been 15 years ago. And I think you're exactly right about access to services for younger people. In Australia, we have very little, and what little we have is under threat, which is very sad. And it's interesting that our most effective advocates are all under 70. And that's been enormously important because it's got the point across that dementia is an illness. It can affect people of any age, and stop thinking about it as something that's the inevitable part of older age. So look, the carer issue can be, I think, a bit divisive in part, but my advice would be to keep on the agenda as it is in paragraph 7.5 of the World Alzheimer's Report as an issue, because without that support in some countries, maybe the majority of countries, people will have nothing unless their families and carers have some education and training.
Thanks, Glenn. Michael Ellenbogen just wanted to make a comment as well.
Hi, Glenn. I just wanted to kind of touch on what Faith just said, and I strongly agree. I've been in this advocacy now for at least 6 years, and the one thing I have come to realize is there's so much focus on the caregivers and so little on the actual people who are living with the disease. I consider ADI as a leading agency around the world who I believe can shed some real light to this issue. While you guys may not have the manpower to do a lot of the support for this, I would hope that you guys could come out with some sort of statement to engage the rest of the associations out there, like the Alzheimer's Association and all the other associations out there, to make some strong recommendation that we need to change the focus, that we're now going to focus more on the people with dementia and not as much with the people who are the caregivers. Not that they're not as important, but we've been focusing for too many years on those people, and part of the problem is because those people weren't out there speaking up like Kate and I are today. And the sad part is there's many of us who no longer can speak up for ourselves, who no longer can write for ourselves, and we're counting on people like you, who is the leader. I do consider you the leader, you and Mark, to drive this home, to send that message out there, and I encourage you to do it soon.
Thank you, Michael. I'm going to sound a bit like a politician, which is terribly sad. I really do think we have to do both, and we have to do both well. I really do. For example, I think the Scottish document on the Charter of Rights, which I guess many of you will know quite well, is an impressive document. And it does say right up front that the objective is to ensure that the rights of people with dementia and carers to a quality of life, to access to the services and things we all expect are there. And I think doing that is right. Having said that, I'd agree with you that probably in most parts of the world, the inclusiveness of people with dementia is not where it has to be. I'd agree entirely with that. I'd also say to you, and Kate might want to comment on this and correct me, but it's my view that in Australia, carers would feel now totally neglected. They would feel underfunded, under-supported, and they would feel that they get all the rhetoric from politicians about how wonderful they are in doing what they do, and none of the support. And of all the organisations nationally in Australia, I would say that Carers Australia struggle almost more than any other to get support. and that they lack support in key areas such as social security. So look, I entirely agree. Don't take anything I've said as negatives about inclusiveness. I also believe that our advocates at conferences and so on in plenary sessions have to be people with dementia. It's not just a tokenistic thing of saying welcome and goodbye. They should be involved in a real substantive way in getting messages across. But I personally, and there's no point in having these discussions unless you can be open, I personally would straddle both sides of the fence and be very supportive of both. And in terms of ADI, I hope that our commitment through DAI is now evident. We can build on that, and maybe in 4 or 5 years' time, that balance will be more even between the two different constituencies.
Thanks, Glenn. Linda had her hand up, and also Mick, I think. Linda? Oh, sorry.
The only care partner in this meeting, I'm not sure. Maybe it's my background and my experience, but I agree with everybody else who's spoken about the lack of focus on people living with dementia. We in Australia, a few of us, are doing quite a bit of work around peri and post-diagnostic support and what's missing, what should be there, how we can impact how people are treated at diagnosis. And we're doing that around a concept of planning with the plan owned by the person with dementia, and of course with the support of their team. It can't ever be just one person, but the person has the plan that goes with them. I often ask myself why I'm so involved in advocacy. Obviously, it's affected my life. It's changed my life totally, having a partner diagnosed. But I can't help feeling that what we all have been lacking, people with dementia diagnosed, and Mick, we've talked about this, and us alongside you, we need to know more about our diagnosis. We need more education. We need to share websites. We need to talk about what we read and what we know. And I'm in a lot of Facebook groups, and I'm active on Twitter. And I have been appalled in Australia by some of the things that I read on dementia carers' websites. But I'm also aware that if I can make some input there, for example, when DAI records something, I can post it. Gradually, people are learning a little bit. So I think that we have a common project here, Glenn, which really is looking at what people with dementia need to know, and need within that, say, first 6 months to a year, when most people go into a big black hole, and it might last longer than that, and they may never get out of it. And similarly, we living alongside people need to know how to understand the symptoms, why they are, what we can do about it, how we can ask the person we're supporting to tell us what they need. And I'd love to see that sort of work continue. And by the way, Glenn, I'm really happy to work with you and Agnes on the Scottish project. I've been interested in Scotland since the mid-90s with all the ScotFEC work. So Kate will give you my email and let's do it.
Agnes
that's good.
Hand up too, Glenn. So
Can I just say one thing? I mean, I think I'm right, Kate, in saying that post-diagnostic support is one of the projects that you've put to ADI, and I think that Scottish concept of a right to a year's guarantee with some flexibility for people that may need it beyond 12 months is a simply wonderful way of avoiding some of the trauma that comes from not knowing what the future is going to hold.
Good.
Agnes, then Mick, and I think that we probably need to wrap it up then.
My apologies for falling asleep. I thought I was going to be rested before what I wanted to say is, and I agree with what I've been listening to, with regards caregivers, care partners, or our loved ones, I think it's equality and collaboration. And I know in Scotland, that's what we believe in, is that I know that the longer I'm in my diagnosis, the more heavily I'm relying on my daughter and people round about me. So I think if we work together on commonalities and differences and respect one another, and hopefully at keynote speak, that we could sit there and be honest and say how it is from the eyes of the person with dementia. And then if you reflect that from the care partner, it's totally different, because I know that I forget the trauma. My daughter does not. So it takes her longer to go over issues than me. And that's where the difference I see is. So it's respect, but see the difference and help one another. I agree that it can't be all the people with dementia and take it away from our caregivers. It has to be equal. We both need help.
Thanks.
And that's what I say. So I agree with you all.
Thank you.
I just wanted to say that, you know, taglines help. And I think that stigma equals denial. Would you all agree with that?
Not sure.
I don't know.
No, I'm not sure.
It's a bit quick.
Well, my siblings have it. They're in denial. And part of it is how the stigmas are. And they don't care for that. So I just threw that out.
Thank you. And I know Mick has had his hand up for ages.
Glenn, thank you for that comment you made about advocacy and the drip of water on the stone and all that. I believe, like Kate, very strongly in advocacy, but there's not enough people in Australia who do it, and we sadly, you know, we are missing out on so much because people won't stand up and talk about their own personal issues, and that to me is what advocacy is all about. Because people are so hungry for that information, but now not everyone can do it. But we need so many more advocates to get out there and spread the word. Otherwise, we are going to go backwards.
Yeah, that's one of our jobs, Mick.
Yeah, I know.
To empower others.
Yeah, I realise.
Yeah.
We're working very hard at it, but like Glenn said, it's like the old drip on the stone.
That's right. Well, I think, Glenn, that we might wrap this up. I'd really like to thank you sincerely from all of the members and the whole dementia community. We had a lot more register, but perhaps because John and I had mixed up times on the original Eventbrite invitation, some people tuned in and we weren't there, and then didn't have time to call back in. But this video will go up onto our YouTube channel. Once I've got the notes from you, it'll go on as a blog as well. So it will impact the whole dementia community, not just people with dementia. I think it's been a really helpful and a really important discussion. Thank you very much. And thank you everyone for attending.
Thank you.